Good morning in America. We are answering your questions directly from our viewers following those two major mass shootings the past couple of weeks, one in Texas, one in New York. Many of you have been sending in your questions on the role of mental health resources. This has become a very partisan issue. Now, while Texas Governor Greg Abbott and Republicans have blamed the shooting in Uvalde in part to the gunman's state of mind in April, we do have some reporting that Governor Abbott did cut nearly $200 million from the Health and Human Services Commission, which oversees mental health services in Texas. Though there are a lot more factors here than what's happening in Texas. There are a lot more factors than what has been decided by Governor Greg Abbott. I am joined now by Michael Thompson. He is president and CEO of the National Alliance of Healthcare Purchaser Coalitions, which is a nonprofit coalition to deliver health care value across the country. Thank you so much for being with us. You know, I would love to talk to you for about an hour about how this conversation has been politicized, because the fact is that there are so many doctors and healthcare professionals who do say that there is some evidence to what kinds of brain and what mental state shooters are in when they commit these kinds of crimes. So we'll save that for last. First, we've got to get to our viewer questions, and Lorianne in North Carolina first. Listen.
Does each individual state set up their own mental health system individually? Or does a higher governmental agency set it up for them? And if each individual state does set up their own mental health system, how is that overseen?
Good question.
You know, it's a somewhat complex issue. Generally, there is no one who owns the mental health system. It's a free market system. Providers are able to practice where they choose to practice, and health systems are able to invest in systems they want. Having said that, the states do contract for the Medicaid programs directly. They also provide licensure both for providers and the insurance companies to provide mental health. And the federal government actually steps in to ensure that mental health is treated on a parity with other health care as part of the Mental Health Parity Act.
We have another question from Lorianne. Let's listen to that.
What improvements and changes have been made to the mental health system in this country that helps prevent people from falling through the cracks of that system?
You know, it's a complex issue again. I think the first and most important part is a level of acceptance in mental health, whether it's the public sector or frankly in the private sector. We have been doing much more to normalize the thinking around mental health, to acknowledge that people need support, need treatment at times, and to recognize symptoms better. Having said that, we still have a major problem with mental health access in the country. Mm-hmm. And we don't typically systematically diagnose for mental illness. Those are challenges that we need to address, and some of the areas that we are focusing on is certainly improving the number of providers that actually participate in networks, ensuring that we do earlier diagnosis with measurement-based tools, and furthermore, to integrate behavioral health into primary care. That's where most people want to get their help.
Yeah, that would be a huge solution, because right now it's just all separated and parceled out. Let me just give you this study here by the Journal of Clinical Psychopharmacology. That's a big word. Of 35 mass shootings that were studied in the U.S. between 1982 to 2019, 28 of the shooters, according to the study, had mental illness diagnoses. So I think a lot of people are trying to figure out, why in the world do we not connect education with health so that we can see some of the markers if somebody does have a mental health issue or is responding to stressors for the past couple of years in the pandemic era that we've been in to the healthcare system?
Well, clearly we're not getting ahead of it as well as we could. Now, it should be recognized that people with a mental illness are not violent. typically. But clearly, there has been examples where people have been empowered with firearms who because of their mental illness, have had incidents, and these incidents have been tragic in all fronts. So I would say, the most important thing is we need to invest in mental health on the front end. We need to really commit to make this a part of our whole person strategy. That
holistic. Yeah, we need a holistic take on this. And again, like you said, not every person with mental illness is violent. And most of the people that you see walking around with you in the office every single day and in your family have something that they could be diagnosed with, but they haven't been diagnosed. Michael, it's something we need to take the stigma out of. Thank you so much for joining us. And thank you to our viewer, Lori Ann, for asking those questions. Still, we do need to check in on each other. So make sure to check in on your friends and loved ones. You can send your questions to newsnationnow.com/answers4America. And we will get your questions answered live right here. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of News Nation's fact-driven, unbiased coverage.